Alright, so we're going to go ahead and try to do this online. This is Unit 2, Lecture 3, the Bones Part 2. So things to have out. One would definitely be your workbook that we have for the class. We're going to be doing some highlighting, some circling, some underlining. I want to make sure that you're just looking at the stuff that I need you to look at. And of course something to do that with, so like a pencil or a pen or a highlighter, all good things to have. One of the other things is that app that I asked for you to download last class, which was that Complete Anatomy 20. So if you have that, that would be another good thing, just so that you can see what's going on with the bones and how they're interacting with one another. So go ahead and get started on this. So the first thing that we're going to be taking a look at are these bones over here to the left. One is shown anteriorly, the other is shown posteriorly. So we're seeing the front and the back of this bone. So what bone are we looking at here? Yeah, this is the humerus. Alright, so I said hint, it's quite a little funny bone.
That was quite funny, dear.
Oh, thanks. So it's the humerus. And is this bone a part of the axial or the appendicular skeleton? Now this is part of the appendicular skeleton. So if you remember the difference between those two, or you need to take a look, please do, so that you can remember between axial and appendicular. So I'm going to ask you to do a couple of things during this lecture, which will have you pause or escape from the PowerPoint. There we go, the PowerPoint presentation here. So one of them is to go to page 159 of your book and go ahead and highlight the parts that we're pointing out on this slide. These are the only things that we're going to focus on. I don't want you to memorize every part of this bone. There's just too many. So go ahead and do that. Go ahead and pause the video and get that done. So now we're looking at a certain structure that I've circled on these bones here. So the first question about this stuff here is the scapula. The scapula contains a cavity on its lateral side. What was that cavity called? So that was called the glenoid cavity. Okay, so the scapula contained that glenoid cavity. So what part of the humerus is going to interact with the glenoid cavity of the scapula? Yeah, the head is. So the head of the humerus actually sits right in the cavity, that glenoid cavity of the scapula. It fits real nice and works out really well actually for us at the shoulder joint. So the really dumb way of remembering this that I have for you is this little phrase. Okay, it's Glenn, go ahead and try to be funny, because the glenoid cavity is Glenn, and a head because the head of the funny bone, which is humerus. So I hope you chuckled a little. But if that helps you remember, that's great. So the next questions that I have for you, what two parts jut out or project at the proximal end of the humerus? Yeah, we have the greater tubercle and the lesser tubercle. So we have the greater and the lesser tubercle that project out at that proximal end of the humerus. If you look on page 124 of your book, you can see that a tubercle is kind of like a little jutting out of bone. Okay, so it's just a jutting out of bone that we have that's on a lot of different areas. Unfortunately, not every jutting out of bone is called a tubercle, but on the humerus it is. So what structure do we find in between the greater and the lesser tubercle? Yeah, that's that inner tubercular groove or sulcus, which makes sense, right? It literally says intertubercular, in between the tubercles groove. Okay, so it's just a groove in between the tubercles. That's why it's called intertubercular groove. Next, we're going to be looking at the shaft of the bone. Guys, we should remember this one, hopefully. So what do we call the shaft of the bone? Yeah, that's the diaphysis, right? We all remember that. That starts with a D, of course. So we remember that, the diaphysis. So what structure do we find as we go down the diaphysis of this humerus? It's the deltoid tuberosity. Okay, so the deltoid tuberosity is on that diaphysis there. So when we look on page 124, look at what a tuberosity is. It essentially tells you that it's a smaller tubercle. So it's just a smaller jutting out of a bone. Most of the time when things jut out from the bone, it's so that muscles will attach, so they have a place to attach. So guys, guess what muscle attaches to the deltoid tuberosity? Yeah, it's the deltoid. The deltoid is going to attach to the deltoid tuberosity. Your deltoid muscle is a muscle that kind of wraps around your shoulder, and it actually will attach to that deltoid tuberosity. Sometimes people name things very appropriately. So now I'm looking a little lower on the humerus. What two fossas do we find at the distal end of the humerus? Yeah, we find the coronoid fossa and we find the olecranon fossa. So a fossa, you can see here, these are like indentations in a bone. So in indentations in a bone, a fossa is going to be interacting with another portion of another bone. So a fossa is just an indentation here. Which fossa is anterior? Yep, the coronoid fossa is anterior. Which fossa is posterior? Yeah, that's the olecranon fossa. So we can see coronoid fossa is anterior, olecranon fossa is posterior. So which fossa is deeper? Yeah, the olecranon fossa is deeper. So to remember which one is anterior and which one is posterior, C comes before O in the alphabet, therefore the coronoid fossa is anterior. It comes first. The olecranon would be posterior, it would come second. Also, we know that the olecranon fossa is deeper. The way that I remember this comes from my brain. So, ready? For the olecranon fossa, it's deeper because, oh, look at that olecranon fossa, it's so deep. Because you know O and olecranon. Anyways, it's deeper. So you'll want to keep that in mind as you study these. Alright, so I gave you a couple of choices for these two detailed descriptions below. Your choices are the capitulum or the trochlea. So looking at your capitulum over here to the left, you see this nice little rounded structure, and the trochlea is much more sharply pointed. So let's go ahead and take a look over there. Which one is a rounded structure on the more distal and lateral side of the bone? Yeah, that's the capitulum. And which one is the sharp structure on the more distal and medial side of the bone? Yeah, that's the trochlea. So again, I have weird ways of remembering this stuff. So I always think with capitulum, I think of a catapult, alright, like a catapult. And normally you catapult round things, right, like a ball of fire or something. You catapult this round thing. And the capitulum is rounded, right? It's rounded. And the trochlea, I just see that it's so sharp. So the T in trochlea, it looks sharp. So, again, if it's helpful, I'm glad. If it's not, I'm so sorry. So when we look down further again, so we've gotten through most of these things actually, and we're left with two things. We have the medial epicondyle and the lateral epicondyle. What will attach to the medial and lateral epicondyles? Yeah, muscle. Okay, so pretty much anytime I ask you what's going to attach to bone, you're going to be like, it's muscle. Okay, every time. So which epicondyle would be found closer to the midline of the body? Yep, that's the medial epicondyle. And which epicondyle would be found further away from the midline of the body? That's the lateral epicondyle. So hopefully you've been labeling or at least highlighting all of these structures. If you go to page 180 of your workbook, this would be a good place to actually label the parts of this bone. So you can just pause, go ahead and write in all of these different words and characteristics here on page 180. Also keep in mind, epicondyles are found on the humerus. You'll see condyles elsewhere, so humerus and epicondyle go together. So I have a little quiz yourself slide here. This is for you to quiz yourself with. So you can always pause, make sure, look around, see what you know. It's always good to test out what you know first before you look it up. So I'd encourage you to do that. I would go ahead and just pause this presentation, see what you know, go back and look at things that you don't. All of the answers for this are found in the slide of the PowerPoint. Alrighty, so we're going to start with the radius and the ulna here. So the important thing here is the radius and the ulna and which side they are on. So when you look at it, you have to think of it in anatomical position. So in anatomical position with that palm facing forward, your radius is on your thumb side and your ulna is on your pinky side. So one time I was teaching this to some of my students, and one of my students was so excited and was like, the radius is on the thumb side because it has a U in it. And I remember looking at him and being like, so does ulna. But nonetheless, everybody remembered that the radius is on the thumb side. So if it helps you, that's great. Another way to remember that the radius is on the thumb side is that you rate things with your thumb. So like Liz Lemon down there, she's given a thumbs up because she's like, yeah, that's good. And you can also give a thumbs down, meaning that's bad. So you can rate things with your thumb. Therefore, the radius is on the thumb side, which makes the ulna on the pinky side. All right, moving forward. All right, I know I just told you this, so hopefully we can remember which one of these is on the thumb side, the radius or the ulna. Yeah, that radius is on the thumb side. And which one is on the pinky side? Yeah, the ulna. Okay, so we're going to start by looking at the radius here. So if you go to page 160 of your book, highlight the parts that are pointed out on this slide. These are what we're going to focus on for the radius. So looking at the radius, we can see that it has a head, and the head is on the most superior surface of the radius itself. So you have to look at this as a complete skeleton. You never want to just look at these things and be like, oh yeah, this is a completely independent bone. No, these things are working together. So when you think of the humerus and you think of the radius, what part of the humerus does the head of the radius interact with? Yeah, it interacts with the capitulum. Okay, so if you're having a hard time seeing that, go find a picture of a complete skeleton and look at it. Look at how the humerus interacts with that radius. You'll see that little ball-like bone structure interacting with the head of the radius. So the radius also has a neck. Where do we find the neck of the radius? Yeah, where you find your neck, right below the head. Right? Okay, so right below the head of the radius we find the neck. Now, I'm really super proud of this animation, so keep this in mind to help you to remember that the radius interacts with the capitulum of the humerus. I put a little cap on the head of the radius. See, it's a little cap. I believe it's a fishing cap, actually. So you put the little cap on the head, therefore the capitulum interacts with the head of the radius. Okay. Alrighty, review, because we gotta do that all the time. What vertebrae holds up your world or your head? That is the atlas, right? The atlas is that very first vertebrae that holds up your head. Alright, what tuberosity do we find on the radius? Yeah, we find the radial tuberosity. So you probably noticed the humerus had a tuberosity, the radius has a tuberosity. What's going to attach to this radial tuberosity? Yeah, muscles. Okay, you're going to get very tired of that question. Muscles attached to tuberosities. Where do we find the styloid process of the radius? It's at the most distal end of the radius. Okay, so at the most distal end, it's distal and lateral on the radius. So you can actually try and find your styloid process on your lateral wrist. You might have to dig a little bit to find it, but it's there. You can feel it. It's very close to your wrist. Okay. Where have we seen a styloid process before? So remember that temporal bone up in your head? Remember that spiky little styloid process? So there, that is there. Yep, so we have a styloid process in our temporal bone, and we also have one in our radius. Now we're going to be taking a look at the ulna here. So again, before going through the parts of the ulna, go ahead and go to page 160, highlight the parts that are pointed out on the slide. This is what we're going to focus on. Alright, so we're looking at some of these words, and you should be like, wait a second. I've seen some of this before, right? You've seen some of these words. What words sound familiar? Olecranon, right? Remember, so the olecranon process. Trochlear sounds pretty familiar. Coronoid should sound familiar as well. Also, there's another styloid process hanging out here. So is there a reason why these all have some familiar names? Of course there is. So we're going to take a look at as why this is the case. So looking here at the olecranon process, we see the olecranon process is kind of this big structure that we have to the ulna. If you actually feel like your elbow, the elbow that you feel is actually that ulna. It's actually that olecranon process that you're feeling. So that's there. So looking at that, what does the olecranon process interact with on the humerus? Yeah, it interacts with that olecranon fossa, right? So it interacts with the olecranon fossa, which makes sense because that fossa was an indentation, and the process is going to fit right into that indentation. Okay, so we have that there. And then we also have a trochlear notch. So what does a trochlear notch interact with on the humerus? Yeah, with the trochlea, right? That sharp structure that's on the humerus. So the trochlear notch is going to interact with that trochlea that is on the humerus. So the olecranon process interacts on the back side, the posterior side, and the trochlear notch is more on the front. We also have a coronoid process on the ulna. We can see that the coronoid process extends off the ulna. The coronoid process is going to interact with the humerus, especially when you're flexing. So what part of the humerus are we actually going to be interacting with? Yeah, it's the coronoid fossa, right? The coronoid fossa is where that coronoid process will fit, okay? So This little boy is flexing a little bit. His coronoid process is fitting right into that coronoid fossa. Okay, now remember, coronoid fossa is in front, it's anterior. Olecranon is in back. It is posterior. So where do we find the ulnar head? Yeah, we find it distal, right? It's most distal on that bone. So I always say that the ulna is upside down. So its head is actually not where you think it would be. It's actually upside down. The ulna also has a styloid process, which you can feel through your skin as well. So that would be on your more medial side. You would find that. So I always remember this by saying, silly ulna, you don't put a stiletto on your head. It's dumb, and actually my husband is pointing at me and pretending like it was really good.
It was really good, dear.
So ulna is upside down and it has a stiletto on its head. Okay, so that's how I imagine that bone to be. This is the third time we've seen a styloid process. So where have we seen a styloid process before? So we have found it on the temporal bone, on the radius, and on the ulna. Okay, so we found it in those three places. So you do have some style in those three places, right? You put like earrings in your ears for some style, maybe a wrist on your, or a watch on your wrist for some style. So maybe that'll help you remember that there's some styloid processes there. Alright, here's another quiz yourself. You know what to do here. Go ahead and just pause, see what you remember, and then we'll continue on. Alrighty, so before we wave goodbye to the radius and ulna and hello to the hand, please go to page 139 and label in color in the radius and ulna, or just label it. Looking at this picture here, what does A represent? A is the ulna, and what does B represent? That represents the radius. Alrighty, so page 160 of your workbook is going to help us out here. Make sure when you look at the wrist and the hand that you're only looking at the carpals, metacarpals, and phalanges. Please don't try to memorize every single carpal bone. I don't need you to know that right now. So maybe if you take like a 400 level anatomy class, I'll have you know that, but not right now. So looking here at this circled part, what is this circled part? Are they the carpals, the metacarpals, or the phalanges? Yeah, those are the carpals. Those are like your wrist bones. You can think of them as your wrist bones. Again, don't need to know every single one of them. You just need to know that these as a bunch are called the carpals. Alrighty, how about these guys up here? Yeah, those are the metacarpals. These are not your fingers, okay? These are not a part of your fingers. These are like your palm. You want to think of them as your palm. They are not your fingers, okay? So your metacarpals are going to be like the palm region there. And then these ones are going to be these are the phalanges. So the phalanges, sometimes you'll hear me refer to them as phalangers. That is incorrect. They are phalanges. So just ignore me. So phalanges are the names of our fingers. Okay, so those are our actual fingers. Looking at the thumb, how many phalanges do we have to the thumb? Yeah, we have 2 in the thumb. And how many phalanges do we have to the rest of the fingers? 3. So we have 3 phalanges to the rest of the fingers and only 2 to the thumb. Okay, so you can go ahead and highlight the phalanges, the metacarpals, and the carpals in your workbook. So looking further at the phalanges, we actually have some more possibilities. So we have A, B, and C there. It's either proximal, distal, or intermediate phalanges. Which one's A? A is distal, so that's your distal phalange. What's B? That's your intermediate phalange. And C? Yeah, that's going to be your proximal phalange. So we could figure this one out, right? If we know what the terms proximal and distal mean, you know what's going on. We call A is going to be our distal phalange because it's furthest away, right? It's the furthest away from the body, therefore it's going to be distal. We call C proximal because it's the one that's closest to the body, and we call B intermediate because, well, it's in between, right? So please keep in mind that thumb right there, it only has two, so it's only going to have a proximal and a distal phalange. These are important in terms of joints because there's a joint between your distal and your intermediate phalange. And that's important to know if you're going to be doing some sort of hand surgery or anything like that. Oh look, another quiz yourself. So you can go ahead and pause this, work through it, figure this all out. I know this lecture is going to take a little bit of time, it always does, but if you stop and pause and look at it, you're going to do fine. Alrighty, so we're going to look at page 161. This is very helpful as we go through the coxal bones, or coxal bones as we call them. Are they coxal or coxal?
I say coxal.
You say coxal? Okay. So coxal bones.
Potato to potato.
Okay. This is our pelvic girdle over here to the right that is labeled A, B, and C. You've seen or should have seen the three of these structures already. So what do we call A? Now that's the sacrum. What do we call B? That's the sacral foramina, right, that hole. And C, that is the coccyx. Now, I'm going to go on a little rant about the coccyx because people tend to forget this. Your coccyx is not like a tail, okay? It doesn't point out like a tail. It points inward. So please remember that, okay? Coccyx is going to point towards your body, not away from it, okay? So coccyx towards your body, not away. All right, end of little rant here. So this image down here that has some colored portions to it, this image we're going to use a lot to describe our pelvic girdle. Notice we're on the lateral and on the right side, so please keep that in mind as we go through. All right, looking at our coxal bone over here to the left, there are three general regions that we find on the coxal bones. What are those three general regions? Those are the ilium, the ischium, and the pubis. Okay, so we have an ilium, an ischium, and a pubis that we find on our coxal bones. Which one would you consider your hip bone? That's going to be your ilium. So your ilium is your hip bone. That's like what you can feel when you put your hands on your hips. That would be your ilium. Which one do you sit on? Yeah, that's going to be your ischium. So your ischium is the one that you sit on. And which one is most medial to your body? That's going to be your pubis. Now, sometimes people forget that the pubis is the most medial to your body, so I have to remind you. When you think of your pubes, where are they? Yeah, they're in the middle of your body. Therefore, the pubis is the most medial to your body, okay? You have to keep in mind when you're looking at this picture, keep this little spinny guy in mind here. You're on the lateral and right side, so your pubis comes together with another pubis on the other side. Okay, so these are medial to your body. Alright, so now we're going to take a look at the most superior portion of the coxal bone here. So what do we call the most superior portion? Yeah, it's called the iliac crest. So the iliac crest is the most superior portion of that coxal bone. The ala is just a general name for the wing of the ilium. That's just a general name. Just what to call it, the ala. What part of the ilium do you touch when you place your hands on your hips? So you might have thought posterior superior iliac spine, but you can't really touch that one. That one's kind of hidden a little deep in your body. You actually touch your anterior superior iliac spine, okay? So the anterior superior iliac spine is what you touch when you place your hands on your hips. They're the ones that kind of jut out a little bit in the front. What's going to go through the thing called the greater sciatic notch? If you said nerves, such as the sciatic nerve, you are 100% correct. So yes, you'll see some nerves go through there. There's other things that go through there as well, but I want you to really focus on the sciatic nerve and other nerves. If you highlight these parts on page 169, it will, or 169, what am I thinking about? 161. So, go ahead and do that to help you focus on what you need to study. So we're going to look at the as-is here. The as-is the anterior superior iliac spine. So that as-is anterior superior iliac spine, that's what you put your hands on when you put your hands on your hips. We also have a pisces, which is the posterior superior iliac spine. Don't tell anyone that I said pisses, but I did. Anyways, posterior superior iliac spine. What's nice is that their names tell us their location, right? Anterior superior iliac spine tells you right where it is. Posterior superior iliac spine, it's in the back. So just keep those two in mind. And again, your posterior superior iliac spine, you don't really feel that part of your bone from the outside. So what I did here, flipped the right coxal bone over to show you the iliac fossa. Guys, it's a fossa. It's an indentation in this case. So what's going to attach to your iliac fossa? Muscles. Very good. So muscles are going to attach there. A lot of your butt muscles are going to attach there. So muscle attachment there. So now we're going to take a look at the ischium. So the ischium is highlighted there in purple. The ischial spine is just a little outpouring of bone, and you guessed it. What's going to attach here? Muscle. Very good. So muscle is going to attach there. The lesser sciatic notch has a similar function to the greater sciatic notch. What would that be? Yeah, it's going to let some nerves go through. And looking at our options, we had our ischial spine, our lesser sciatic notch, and our ischial tuberosity. Which projection would be considered the butt bone? Yeah, it's the ischial tuberosity. In fact, I have a little chair right there that is underneath its name. You sit on your ischial tuberosity. So if you've ever sat in bleachers, or just a really uncomfortable chair and you feel that like numbness and that like my butt hurts, it's that ischial tuberosity that's hurting you. So you can blame that the next time you feel that pain. Just like throw out your anatomy knowledge. Like, oh, I was sitting watching the game and my ischial tuberosity was hurting. Yeah, you'll sound real smart.
Just like April and I.
Yeah. So you can highlight these parts on page 161. Alrighty, so now we are looking at a few other things. We have a acetabulum, we have a obturator foramen, and we have a pubic arch. So we're going to take a look at those three things. What two parts of the coxal bone come together at the pubic arch? Yes, that ischium and the pubis. So where the ischium and the pubis come together, we find the pubic arch. How would you describe our obturator foramen? A giant hole. Very good. All right, so it's a giant hole that we find in our coxal bones. Now, this is just a foramen, so it's a hole. It's covered with a membrane. It only allows small blood vessels and nerves to go through. 100% all that is. Alright, it's just a membrane. It only allows small blood vessels and nerves through. It is not where the femur inserts into the coxal bone. It is not where that happens. So please, please remember that your obturator foramen is not the place the femur goes. Okay? Can we remember that? Obturator, not where the femur goes. So I make a really big deal about this because every year someone tells me that the obturator foramen is where the femur goes. Meh. Don't be that person. Okay? So since I made a big deal about it, there is a place that the femur actually inserts into, and it's called the acetabulum. And you're right, I can't say the correct word because I honestly just cannot pronounce it. So the acetabulum is where your femur is going to insert into your coxal bone. Alright, so looking at the entire pelvic girdle, so we've gotten through the coxal bones and now we put them together. Okay, so we can see the two pubis are coming together right there, and we have some nice structures that hopefully look familiar. So the pubic symphysis is where what parts of the coxal bones come together? Yeah, it's where the pubis comes together, right? The two pubis come together where the pubic symphysis is. So looking there, we see a pubic symphysis. The pubic symphysis is made of fibrocartilage and is slightly movable. Why would it be a good idea for this area to be slightly movable? Yeah, hopefully that little baby gave you some indication. So babies sit in that general location in a woman, and it helps to have a little bit of wiggle room with the pelvis so that it's easier to push out a baby. Now the baby doesn't come out of the pubic symphysis, okay? The hip bones don't just come apart and a baby doesn't come out, okay? That's not what happens. But it's nice to have a little bit of wiggle room so that we can expand the hips just a little bit so that we can push a baby out a little bit easier. Alright, so now we have some structures of the pelvic girdle. We have a greater pelvis, a lesser pelvis, the pelvic inlet, as well as the pelvic brim. So what do we call the larger wing of the pelvic girdle? Yeah, it's the greater pelvis. What do we call the smaller wing of the pelvic girdle? Yeah, that's the lesser pelvis. What is the opening found in between the coxal bones called? Yep, that's the pelvic inlet. And what are the edges of the pelvic inlet called? And that's the pelvic brim. So if you go to page 139, go ahead and fill in what you can, and then go to page 181 and fill in what you can. It's always good to label in color and kind of go through these. You just got to do it. You just got to try real hard to get all these down. Alright, a review slide, you know what to do here. And another review slide, you know what to do here. Alrighty, we're going to move on to the bone that interacts with the pelvis at the acetabulum. What bone is going to interact with the acetabulum? Yeah, one of the biggest bones of your body, the femur. Okay, so the femur interacts with the pelvis at that acetabulum. Is that good old femur? So, you know, if you were getting tired of me not having any jokes, here's a great one. Okay, so you're not an acetabulum, you're a facetabulum, because the femur fits into the acetabulum.
Oh boy.
Alright, onward. Before we get started with the femur here, go to page 163, highlight the items we're going to be focusing on, give them a circle, and then we'll talk about each little part. Alrighty, we should know this one. What does the head of the femur interact with on the pelvic girdle? Yeah, it's that acetabulum. Oh boy, it's the acetabulum, that's what the head of the femur interacts with. Looking down a little further, we see the fovea capitis. Fovea means a small pit, and capitis means head. So the fovea capitis means a small pit on the head, and that's what it is. We find the fovea capitis, a small pit on the head of the femur. Okay, so that's just the little pit that we find. What do we find just inferior to the head of the and the fovea capitis? The neck. So we find a neck right below the fovea capitis. Alrighty, I always like to point out we only find trochanters on the leg bones. Just imagine, like, you can't, like, do a chant without a leg bone in your hand. Like, it's got to be a leg bone. Think of those movies where, like, they have people chanting around a campfire and they're like, rah, with a little femur in their hand. Anyways, only trochanters are only found on your femur there. So the greater trochanter is larger than the lesser trochanter. Can you guess why we have these on the bones? Very good, muscle attachment, right? That's why we have these here. And where is the intertrochanteric line at? That's in between the greater and the lesser trochanter. Very similar to what we saw on the humerus, right? So intertrochanteric means in between the trochanters, literally. So we're literally talking about the line that's in between the trochanters. If you remember back with the humerus, we had a greater and a lesser tubercle, and then we had an intertubercular groove, right? So same type of concept that we have in between the bones. So what ridge do we find along the femur's diaphysis? Yep, we find the linea aspera. So why are we going to have a ridge of bone there? Muscle attachment, excellent. It's also going to be a little bit of a supporter, so it's going to help support the bone really well. So muscle attachment is there. So the way that I remember this is, like, I think of Aspen and I think of Colorado and skiing, and if I went skiing I would definitely break my femur. So that's how I remember linea aspera, is because I'd go skiing and break my femur, and I think of that. But there's also someone who wasn't listening one time in lecture, and they asked me if I was talking about a line of asparagus, and I was like, really? Like, no, that's not even a thing. But if you want to remember it as that, you can think of like a little child that is supposed to eat their asparagus, and instead of eating it, they line it up on their femur, like they put it on their leg, hoping their parent won't see it. And got a little line of asparagus. No? Okay. I gave it a shot. Alright, onward. So what two condyles do we find at the distal end of the femur? Yeah, we find the medial and the lateral condyle. Very good. What do we find in between the medial and lateral condyles? The intercondylar fossa. Again, a great name. It tells you right where it's at. In between the condyles, fossa. Now, these are condyles in the femur. On the humerus, what did we have? We didn't have condyles. We had epicondyles. Very good. So on the humerus, we had epicondyles. On the femur, we have condyles. No real easy way to remember this. They're just different based on whether they are in the upper limbs or on the lower limbs. What do we find on the anterior distal end of the femur? Yep, we find a patellar surface. Okay, so the patellar surface is going to interact with what? The patella. Very good. So we do have a patellar surface on the femur, and the patella is going to sit right on there. So if you go to page 139, you can fill in what you can, and then you can go to page 182 and fill in what you can for the femur. Have a review slide here. You know what to do. Go ahead and give it a try. Alrighty, so before we get started on the tibia, we're going to go to page 164, highlight the items we're going to be focusing on, and then you can go ahead and continue on with the presentation. Alrighty, so I have a lateral condyle and a medial condyle on the tibia that I've circled, and then I'm like, what is going on, right? Whoa, wait a second, didn't we just see a lateral and a medial condyle on the femur? And yes, we did. Okay, so what do the medial and lateral condyles of the tibia interact with on the femur? and they interact with the lateral and medial condyles of the femur. Okay, super easy connection. Use those to help you. Okay, use those connections to help you. Never memorize everything. Memorize little bits and then make connections. Alrighty, there is a small bump you feel just inferior to your patella. So if you take your fingers and you go right below your patella, you should feel a small bump. What do we call that small bump? Yeah, we call it the tibial tuberosity. Again, things that you should start to see a pattern, right? Remember, there was a radial tuberosity, there was a deltoid tuberosity, there's tuberosities all over the place. So this one is your tibial tuberosity. What outpouring of bone do we find along the diaphysis of the tibia? That's your anterior crest. So that's the bone that you feel, the part of the bone that you feel in the front of your tibia, essentially, the front of that lower leg bone. You typically refer to that as your shin. Okay, so that anterior crest, you'd think of it as your shin, okay, or your shin bone. So I like to say the tibia has a lot of tact because it has a tibial tuberosity as well as an anterior crest. That's all I got for you there. We also have a medial malleolus, really easy to feel. If you place your fingers on the medial side of your ankle, the bump that you feel is the medial malleolus. It's quite large. It helps support our weight really well. So medial malleolus, you feel that bump. That's it. That's your medial malleolus. So before you move on, there's something you need to know. This is how I feel about these bones. I think the tibia is tough and it has lots of tact, right? I got that tibial tuberosity, anterior crest, and I think the fibula is effing worthless. Like, I feel this way about it. It's terrible. I'm quite mad at it a lot of times, and I'm not really sure why, but I do think it's just effing worthless.
That's the reason we taught John Wilkes Booth. Remember that?
That's true. I mean, it did help us catch a president murderer, but it isn't worthless, but the fibula doesn't do much for you. Okay, if you're hearing like random cracking noises, my husband is in a recliner right now, and every once in a while it like jolts down, and also he's eating peanuts, so you might be hearing that, and that's okay. Alright, moving on. So before we get started with the stupid fibula, we're going to go to page 164, highlight the items we're focusing on. Look at how stupid it is. We're only going to do 2 things on it. That's how dumb it is. Stupid fibula. So where do we find the head of the fibula? Yeah, it's on its proximal end. In comparison to the ulna, where did we find the head of the ulna? Yeah, the ulna was most distal, right? It was upside down, and the radius was proximal too. So the radius and the fibula have their heads on straight. Your ulna, he's all upside down, a little stiletto on his head. What side of your ankle would you find the lateral malleolus? Yeah, the lateral malleolus is on the lateral side. So it's on the outer side of your ankle that you have there. So unfortunately, the lateral malleolus, along with other things such as tendons and muscles, they don't protect us as well as the medial malleolus. Which is why, if you've ever twisted your ankle, you've probably twisted it laterally. You've twisted it on that side because the fibula is stupid. It's so annoying. It's so little, and it doesn't do its job right. But anyways, the fibula is smaller, but it does contain a head, and it does have a lateral malleolus. So if you go to page 139 again, fill in what you can. Go to page 182 and fill in what you can. Alright, here's another review slide. I promise we're almost there. We're almost there. So we have the ankle and the foot. The feet are very much so like the hands. We can probably relate these to each other. So the circled region, what do you think the circled region is? Yeah, those are the tarsals. Okay, so the tarsals is that circle region, kind of that ankle-y region that you have to your foot. What two bones are part of the tarsals? And we have the talus and we have the calcaneus. So what two lower leg bones rest on the talus? Yeah, you have your tibia and your fibula. So those two lower leg bones is going to be your tibia, and your fibula will rest on that. What bone would be considered the heel of your foot? Yeah, that's your calcaneus. So I always think of my calcaneus, if you've ever been like a door is like shutting or something and you didn't move your foot fast enough and it slams into the back of your heel, I always say that I've cracked my calcaneus. So I cracked my calcaneus, I hit the back of my foot, the heel of my foot. And then there's also like when you were growing up and there was somebody with a cart behind you, probably a sibling that had the cart, and they ran into you with the cart. It probably hit the back of your foot and the calcaneus. And just imagine how cool it would have been if you could have been like, "You cracked my calcaneus!" Would have been pretty awesome. Alright, we're almost there. Just hang in there. What is this circled region? So the metatarsals. Sound an awful lot like metacarpals, okay? So please remember the difference. Your carpals are in your hands, your tarsals are in your feet. We also have these guys here, which would be our toes. What is this circled region? Yeah, these are the phalanges. Just like the hands, the phalanges of the feet all have three parts except for that big toe. So we do have distal, intermediate, and proximal regions to the phalanges. Which one is which one? So A is going to be our distal phalange, B is our intermediate phalange, and C is going to be our proximal phalange. Remember, the big toe only contains a distal and a proximal region. Okay. Here's a review slide. You know what to do here. Alrighty, so for this stuff here, don't worry about putting together a small skeleton and the magnetic skeleton. We will do that next class because I do think it's an important activity. All I need for you to do right now is to take notes over all this material and be prepared for a quiz when you come back on Monday night. Homework from this lecture is this stuff here. Make sure that you are doing this and keeping up with the homework. Don't label anything that we didn't talk about, okay? Only label the things that we talked about. Alright, I hope you guys have a good night, and I will see you later.